Hi guys, welcome to our abdomen anatomy. Today we're gonna talk about the gross anatomy of the liver. I know we have been waiting so much to get into this lecture, um, and now we are now into it, is it? So the liver. Let me just talk a bit about the facts of the liver. It's actually very fascinating. You know how God designs these things. It's actually fascinating. The liver is actually the project manager of the body. It everything that comes through the GIT, it goes through the liver, except the lipids that will bypass the liver by getting into the lymphatic system. But most of the things, everything from your GIT, your fats, your fiber, your vitamins, they all go through the liver. So the liver will actually say, okay, um, how much should we break, and how much should we assemble? How much does the body need? How much should we store? So the liver is about the 200, over 200 uses in the body. Imagine. And it is the largest organ in the body, the second largest organ. It is the largest internal organ in the body. And it is second to the skin. The skin, we know that it is the largest organ in the body, but the liver is the largest internal organ in the body. It is also an exocrine in the endocrine gland, which is involved in the synthesis of proteins, your albumin, your plasma proteins. It also synthesizes bio and stores glycogen. It stores glucose in the form of glycogen. uh you know by so there are so many um uh functions of the liver. So today we're going to talk about the gross anatomy. In terms of weight, it in terms of weight, uh it is about 2.5 percent of total body weight. And embryologically, the liver is a hematopoietic organ, and in the embryo, it has about 10%. It occupies 10% of total body weight because of the hematopoietic activity. Right. So the liver. Let us take a look at um, which part does it occupy, which region does it occupy from your anterior abdominal wall. Right. So let me take a look for. Let us take a look. Right. So most part of the liver is found in the right hypochondria. A small part is found in the left hypochondria. So it extends from the right hypochondrium, enters the epigastric region, and a small part being in the left hypochondrium. The liver is covered by your costal margin of 7 to 11 costal cartilages, right? Um, from 7 to 11 ribs. So it's actually covered, right, by your costal cartilage. Your liver as well um, is going to be, yeah, it has a convex diaphragmatic surface that fit in the concavity of the diaphragm. So if you remember in thorax anatomy, we said that the right hemidiaphragm or dome of the liver is higher than the left dome of the liver due to that the right lobe of the liver is bigger than the left lobe. So we would actually say that the right dome of the liver extend up to the upper border of the fifth rib, whilst the left dome of the liver of the diaphragm extends up to the lower border of the fifth rib. So the liver is surrounded by a capsule, which is called a Gleason's capsule, right? It's just a thin capsule, and it is surrounded by peritoneum, except a portion which is called the base surface of the liver, which is absence with absence of peritoneum, right? So let's take a look deep now um, into the anterior surface of the liver and posterior surface of the liver. So the diaphragmatic surface of the liver is actually convex. The visceral surface of the liver is actually concave, and it has impression of organs, visceral organs, that the liver sits upon. So let's take a look. So right here, this is your convex surface of the liver. You can actually see, right? And it will be fitting in the concavity of the diaphragm, right? And then the visceral surface of the liver, it actually has these impressions upon the organs that the liver will sit upon. So this right here is your right lobe. This right here is your left lobe. Take note, anteriorly, the right lobe and the left lobe, they are divided by this remnant of your visceral mesentery, which is called the falciform ligament. The falciform ligament, it actually divides your right and left liver lobe. And remember, in the free edge of your falciform ligament, that's where you have your ligamentum teres hepatis, or the round ligament of the liver, which is actually accompanied by your para-umbilical veins, which will be draining into the portal veins. Right. Before I get into much of this falciform ligament, let's take a look at the right and the left lobe of the liver. The right lobe of the liver is actually bigger than the left lobe of the liver, as you can actually see. And most of its part is covered anteriorly. It's going to be protected by the costal margin of 7 to 11 ribs, right? The left lobe is actually small, and this left lobe, right, is going to be, let's look at the visceral portion. The left lobe of the liver is going to be sitting on the gastric uh, on the gastric, or on the fundus of the stomach, right? And you can actually see this is the esophagus impression, right? And this is your duodenum impression, right? So what is anterior to the liver? So we are going to have the diaphragm, the pleura, and a part of the lung. We are going to have your anterior abdominal wall, and not forgetting those costal margins, right? That will be protecting your liver. What is posterior to your liver? Posterior to your liver, you're going to have these. Everything that makes an impression on the liver is posterior to the liver. The stomach, the abdominal part of the esophagus, the duodenum, the right kidney and its suprarenal gland, and the hepatic colic flexure, or the right colic flexure. These are structures, without forgetting the gallbladder itself and the inferior vena cava. These are part of the posterior structures of the liver. Good. Let's take a look at the peritoneal of the liver. So, anterior, we said we have the falciform ligament that connects the liver to the anterior body wall. And this falciform ligament, as it goes superiorly, it's actually going to extend as coronary ligament. So the left coronary ligament is going to give a posterior and an anterior, right? We're going to have an anterior and the posterior coronary ligament, and the left coronary ligaments, anterior and posterior, will actually form what's called the left triangular ligament right here. And then the right coronary ligament is going to be divided into anterior and posterior, and they are going to meet and form the right triangular ligament here. right? So there is a space between the anterior and posterior right coronary ligament. Mostly, that is what we call the base surface of the liver. So you can actually appreciate that this was your anterior coronary ligament. This is your posterior coronary ligament, right? Your posterior coronary ligament is actually an extension of the lesser sac, right? Good. So you're going to have an impression, right, which is called the base surface of the liver. So this portion is not covered by peritoneum, right? So you can actually see your left triangular ligament made by the fusion of the anterior and posterior coronary ligaments. Your right triangular ligament formed by your anterior and posterior coronary ligament, right? But to the right, you're going to have an impression called the bay area of the liver. Good. And then another portion of the liver that is devoid of peritoneum is the portion where you have your gallbladder, which is your gallbladder fossa. Right. Another important fact about the falciform ligament is this. If you are to look at this orientation of the liver, let me show you. Right, so there are races or spaces that are formed by the folding of peritoneum. So above the liver and at the superior and anterior border, you're going to have a subphrenic recess, which is made by the fold of peritoneum. And take note of this. This subphrenic recess is divided into right and left by the falciform ligament. Right, so the falciform ligament will actually divide the subphrenic recess into right and left. And it is this recess that will communicate with the paracortic gutters, right, which we said when we were doing uh, when we're in our video of peritoneum. We said we have paracortic gutters, and the right paracortic gutter will actually lead to communication with the right phrenic recess. So a brace coming from the appendicitis will actually can be found in the subphrenic recess due to the communication of this infracolic region and the supracolic region via the paracortic gutters. You understand? Another important thing, we spoke of the base surface of the liver. And it is within the base surface of the liver that's where you have the groove of the inferior vena cava. So the inferior vena cava is actually found in the groove within the base surface of the liver. And the base of the liver is mostly formed within the right lobe of the liver. Right? It is mostly formed within the right lobe of the liver. Good. Now, let us take a look at the visceral surface of the liver and the caudate and quadrate lobes of the liver. Right, so the visceral surface of the liver is what you call the right sagittal fissure, the left sagittal fissure, and the transverse sagittal fissure. So there is sort of like an H arrangement dividing your liver into a caudate lobe above and a quadrate lobe below. You understand? Good. So let's take a look at these fissures. We actually know that this is your left lobe and this is your right lobe. But at the visceral surface, you're going to have what you call the caudate lobe and the quadrate lobe. Take note of this. The caudate and the quadrate lobe, anatomically, they are part of the right lobe of the liver. But functionally, they are part of the left lobe of the liver. What does this mean? It means that functionally, the caudate lobe and the quadrate lobe, they actually receive the same blood supply that goes to the left lobe. So you're going to have your left hepatic artery supplying the caudate lobe and the quadrate lobe and the left lobe within the left lobe of the liver. But anatomically, these structures, they belong to the right lobe of the liver. What actually demarcates these caudate and quadrate lobes? Well, we have what we call a right sagittal fissure and a left sagittal fissure and a transverse fissure. Let me start with the left sagittal fissure. Right, embryologically, you'd understand that we were going to have an umbilical vein that will leave the umbilical cord and then ascends upward within the free edge of the falciform ligament, right? And then it will be carrying well oxygenated blood from the placenta, and then it goes to your liver, right? And then it bypasses the liver via what you call your ductus venosus, and then directly drains into the inferior vena cava. You understand? But during birth and after birth, there's going to be obliteration of the umbilical vein, which will become your round ligament of the liver, or the ligamentum hepatis, the ligamentum teres hepatis. So this portion of the left sagittal fissure is going to be made by the round ligament of the liver, right? And then we have that portion that was bypassing the liver, which is your ductus venosus, which you also later obliterate and becomes your ligamentum venosum. So your left sagittal fissure is made by the round ligament of the liver and your ligamentum venosum. Good. The right sagittal fissure is formed by the inferior vena cava and the gallbladder. The space between the inferior vena cava and the gallbladder is going to be called a quadrate process. So the quadrate process actually divides the inferior vena cava and the gallbladder. That forms your right sagittal fissure. Your transverse sagittal fissure is formed by the porta hepatis, which is the hilum of the liver. Within the porta hepatis, you have structures that are entering and leaving, right? For example, you have the bile duct, your hepatic portal artery, your hepatic portal vein, your hepatic lymphatic system, as well as your sympathetic and parasympathetic innervation, right? They will be found within the portal hepatis. So it is the portal hepatis that forms your transverse fissure. Let's take a look at another diagram. Right, so here you can actually see that we said this is your caudate lobe, your quadrate lobe, right? For you not to confuse that which one is superior than the other, you just say C over Q, C over Q, C over Q. C starts first in the alphabetical order, and then Q and last. So C should be above, and then Q should be below. Simple. So you're going to have this left sagittal fissure made by one, the ligamentum teres hepatis, this portion, and your ligamentum venosum, right? Then the right sagittal fissure, this portion is going to be made by your gallbladder, this portion is going to be made by your inferior vena cava, and this portion is going to be made by your caudate process. Then the transverse fissure is going to be made by the porta hepatis, which is your hilum of the liver. Let's take a look at this diagram beautifully. Right, this is your ligamentum teres hepatis that is obliterated, and then this is your ligamentum venosum, right, which is the remnant of your ductus venosus, and then this is your porta hepatis, where you have the entrance of your portal triad, right? So you have your portal vein, your hepatic artery, and your bile duct, together with some lymphatics as well as sympathetic and parasympathetic nerves, right? This is the quadrate process, right? Which I said it divides the inferior vena cava from the gallbladder. Good. So the quadrate lobe and the quadrate lobe anatomically they belong to the right lobe, but functionally, as you're gonna see, as we are gonna do the blood supply of the liver, they belong to the left lobe. Let's take a look at the blood supply of the liver. Now let's take a look at the blood supply to the liver. The liver, it receives dual blood supply as the lung, right? So it's going to receive blood from the portal vein. About 75 to 80% of the blood going to the liver will come from the portal vein. And then that blood, about 40% of the blood will be carrying oxygen, right? And then you're going to have blood coming from the hepatic artery proper, which is a branch of the common hepatic artery, which is a branch of the celiac trunk coming from teeth off of the abdominal aorta, right? So the hepatic artery proper is going to bring about 20 to 25% of the blood to the liver, and this year is about 80% to 60 to 80% of oxygen, right? So what happens is this: when the portal vein enters and remember, this portal vein is formed behind the neck of the pancreas at the transpyretic plane by the combination of the splenic vein and the superior mesenteric vein. So the portal vein enters the hepatoduodenal ligament, and then it enters the portal hepatis, right? Inside the portal hepatis, it will start to divide itself. You're going to have the right branch of the portal vein and the left branch of the portal vein, right? And these branches will continue to divide, up until they get into the sinusoids of the liver. And from the sinus of the liver, they drain into the central veins. From the central veins, these central veins, they will meet, and then they'll form hepatic veins. So you're going to have about three hepatic vein, a right hepatic vein, an intermediate or mid hepatic vein, and your left hepatic veins. And these hepatic veins, they will drain into the inferior vena cava. Take note, these hepatic veins, they also facilitate, right, the stability, or they actually hang the liver from the inferior vena cava. So they actually attach the liver to the inferior vena cava, which is actually very important, right? Then we have the within the liver sinusoids, right? Within the liver lobe, you're going to have what you call remember from histology, the liver can actually be divided into what we call a portal triad, which shows the exocrine function of the liver. So you're going to have bile being secreted by hepatocytes into your bile canaliculi. From the bile canaliculi, you get into bile ductus. From the bile ductus, they will join and form what we call common. They'll form a hepatic bile duct, and this hepatic bile duct, they will join and form common hepatic ducts. And it is the common hepatic duct that will join with the cystic duct to form the bile duct, right? So right here, you can actually see this is your bile duct. Your bile duct is not yet formed, but your bile duct is the one that will go posterior to the first part of the duodenum, and then it travel through the groove of the up of the head of the pancreas, and then joins the main pancreatic duct and enters the major via the duodenum via the major duodenal papillae. Right, good. So the hepatic artery will divide into right and left. The right hepatic artery will give another branch, as we're going to see, which is called a cystic artery. And that cystic artery will actually supply blood to the cystic duct and the gallbladder. You understand? So in short, that's the blood supply of the liver. Right. Let's take a look at the the nervous, the lymphatic drainage of the liver. Right. So the lymphatic drainage, you just have to understand that the liver comes from the foregut. Right. So it's going to be supplied by branches coming from the foregut, which is a part of the hepatic artery. So the hepatic artery will actually be surrounded with what we call hepatic lymph nodes. These hepatic lymph nodes, they'll later drain into the the celiac lymph nodes. And from the celiac lymph nodes, we go to the intestinal trunk. From the intestinal trunk, it will drain into the cystina chyli and then form the what? The thoracic duct. Simple as that. And take note of this. Um, the liver, since it's the largest internal organ, about 1/4 to 1/2 of the lymph of the body comes from the liver. How fascinating is it? Comes from the liver, right? Let's take a look at the innervation, the nerve supply to the liver, innervation. Right, good. So your liver is going to receive a parasympathetic and sympathetic innervation, right? Um, so the sympathetic innervation is going to come from the celiac plexus, um, and then the parasympathetic is actually going to come from the mainly from the anterior vagal trunk. If you remember very well, the course of the anterior vagal trunk, when we did the anatomy of the stomach, we said the anterior vagal trunk, it has a major contribution of the left vagus nerve, and when the anterior vagal trunk leaves the esophageal hiatus, it goes anterior to the stomach. It gives a branch which is called a hepatic branch, right? And this is the hepatic branch that is going to form the hepatic plexus. You understand? Good. So that's basically the innervation of the liver, right, guys? So that's everything that you have to know and understand about the anatomy of the liver. Before I close, I want to show you something that is very interesting. Right here, you have a section, right, of how the liver functions. Right, so these are going to be your hepatocytes. They are going to be in plates, and then these within these are your sinusoids, right? So your sinusoid is going to have blood from the hepatic artery and the portal vein, and this blood will go towards the central vein. You understand? But while the blood is going towards your central vein, the hepatic cells, the hepatocells, the hepatocytes, they'll actually be synthesizing and secreting some proteins into this blood, your plasma proteins, your albumin, and so forth. Right. So this is what we call the hepatic nodule, the hepatic lobule, which actually shows the excretion, the, the, the endocrine function of the liver. Right. So in opposite direction, you're going to have what you call biocanaliculi. Right. These are your biocanaliculi. Right. So bile will actually be uh, flowing in the opposite direction to the blood in the sinusoids. You understand? Good. So these biochemically they will meet the bile ductus and later form the hepatic bile duct. Right. Between the sinusoids and the hepatocytes, you're going to have what called the space of this. And it is the space of this where you're going to have your ethel cells, your your Kappa cells, which are sinusoidal macrophages, your microvilli, as well as blood plasma, which will be coming from the what? From the sinusoids. Is it? So yeah, thank you so much guys for listening. Take care.